Alright, so we did United States versus Germany health insurance. Throughout this presentation, we're going to be comparing United States health insurance to Germany's. So, United States healthcare overview. America's healthcare system can be best described as a hybrid system incorporating private and public health insurance within it. 48% of U.S. healthcare spending came from private health insurance and households, and 20% coming from private businesses. The federal government accounted for 28% of the spending, while the state and local governments accounted for 17%. Most healthcare even publicly is publicly financed and delivered privately. 28.5 million, or 8.8% of Americans, did not have any health insurance during 2017, and 294.6 million, or 91.2% of Americans, did have coverage during 2017.
The public health insurance in the United States consists of Medicare, which is a federal program that provides health insurance for anyone 65 or older, or if you have a severe disability. There's also Medicaid, which is a state and federal program for low-income families. And Medicaid restrictions and regulations vary by state. There's currently 59 million people enrolled in Medicare and 74 million people covered in Medicaid, which ends up being 33.7% of Americans.
Alright, so 67.7% of Americans are covered under private health insurance. These insurances come from mostly employer-based insurance that covers up to 56% of Americans. And 16% of Americans have direct purchase, meaning that they directly purchase their own insurance through an insurance agent. Examples of private health insurance are Humana, Blue Cross Blue Shield, Aetna, and there's various others. There are several different types of health insurance plans. There's generally four main ones, and these are preferred provider plans, health maintenance organizations, point of service, and high deductible health plans. So the thing with preferred provider organizations, they're really strict you onto who you can go see for your provider. They have a list of the ones within their network, and if you go outside those networks, you are not covered by insurance. And then you have a health maintenance organization, which is similar to that, except you have a little bit more freedom, but you just have to pay a little extra. And then with a high deductible health plan, essentially you pay a lower premium every month, but you have a higher deductible to meet. Generally, this is for a younger, healthier population. And then point of service is a mix between preferred provider organization and health maintenance organization.
All right, so some of the positives of the United States healthcare system. Modern medicine is a big one. The United States leads the world in healthcare technology innovation. Doctors and nurses have access to the latest and most modern technology that can help accurately diagnose pretty much any diseases to those patients. Another good one is the quality of healthcare that you receive. U.S. physicians and surgeons are among the best trained in the world. Due to specialty and subspecialty training, you can find doctors who work with rare conditions that you might not be able to find in other countries. Some of the bad parts of the United States healthcare system are if you're uninsured or underinsured, you may have to be limited in the health service which you have access to. So if you don't have insurance, you might not get the best care, which isn't really good. Most people get insurance through their jobs, and unfortunately, if you get fired from your job, you might lose your health insurance as well. Medical debt is also the leading cause of bankruptcy in the United States, which is not good. And it shows in this graph that the United States spends about double of any other country on that chart, so that's also negative that comes along with United States healthcare.
All right, so I'm covering the German healthcare, and in Germany there are two separate types of systems. The first is the statutory health insurance, which is competing not-for-profit, non-governmental health insurance funds This is a system that is provided for any citizen whose income is less than 56,250 euros, or about 71,000 US dollars. The substitutive private health insurance, this is a system for citizens earning more than 56,000, or again, 71 US dollars, or any self-employed individuals are also allowed to purchase this private health insurance. All right, so the publicly financed health insurance, in 2014, 11.2% of the German GDP was associated with health expenditures. The general tax financed on extraneous benefits are provided by SHI, which is the publicly financed, which is included for children. The total extraneous benefits were about 4.5% of the total expenditures. Coverage is universal for all legal residents. Individuals whose income is greater than 56,000 euros or is self-employed, like said before, can also be in the private healthcare, but have the choice of being in the public healthcare system as well. PHI also covers civil servants within the community, and then along with that, refugees and immigrants are covered by the Social Security in Germany, and anybody with an acute illness who's traveling to Germany or is pregnant and is in Germany will be covered by Social Security. So the private health insurance, 8.8 million people were covered by private health insurance in 2015. Private health insurance is extremely attractive to younger adults who have a good steady income. This is because insurers are most likely to offer lower premiums and a wider range of policies. In 2016, there were about 42 different firms, private health insurance firms, of which 24 of them were actually for-profit. Along with covering the individuals who purchase this coverage, private health insurance also covers civil servants, as mentioned before.
So the greatest strength of the German healthcare system is that it's 100% comprehensive of the entire population, with the statutory premium being based off your income around 14.6%. Another great feature is the medical innovations that rapidly finds its way into treatments due to incentives and special reimbursements by the government. And according to the WHO, Germany is ranked 25th in the world in healthcare, but #1 with the amount of physicians per patient. There's a few negatives with having the German healthcare. Due to the high quality of healthcare, it is one of the most expensive to maintain and improve for the country. One of the large weaknesses within it is the system has economic incentives to facilitate procedures instead of patient care. Another weakness is that the healthcare workers are worth a lot less money, so a lot of doctors in Germany flee the country to get 3 or 4 times more pay. And then a common complaint within the system is the delay for non-essential treatments and referrals compared to a private system such as America, where you have demand and supply.
This is a short video that explains the German healthcare a little bit better and gives a bit of background about it.
Let's work together to get our patients home for the holidays. Here at Bias Group,
My patron Hauke suggested that I spend a video talking about healthcare in Germany, which to me didn't sound like the kind of thing that you would want to listen to for 4 or 5 minutes. But actually, there are some important things to say about it. German health insurance goes back to the year 1883 and Chancellor Otto von Bismarck, you know, the hardline, strict, authoritarian, warmongering politician who united most German-speaking territories into a single nation-state. He created a system whereby factory workers earning less than a certain amount were able to get health insurance. At the time, that was about 10% of the population, but since then, more and more people have been included, and so here we are 130 years later. There are 2 types of health insurance: statutory health insurance and private health insurance. Which type of insurance you get will depend on the type of job you have and some other complicated factors. If you are employed by a company, that is, you are on their payroll, you may be eligible for statutory health insurance. How much you pay depends on how much you earn. Your employer pays a share and the rest is automatically deducted from your wages or salary, so you don't have to do a thing. The insurance company, known as Krankenkasse in Germany, issues you with a card. When you go to the doctor or dentist or hospital, you present this card and that's all you need to worry about. No fuss, you get your treatment and your medication and the insurance company pays for it. Some other groups of people also get statutory health insurance. Those registered as unemployed, for example. Their premiums are paid by the relevant government agencies. Private insurance is for everybody else. It's a normal insurance policy, so how much you pay will depend on how much of a risk you are. The younger and fitter you are when you join, the lower your premiums will be. If you need medical treatment, you state that you are privately insured. You later get an invoice which you pay and then claim back from the insurance company. If it's very expensive, you can usually arrange to pay in installments. If you know in advance that you're going to need expensive treatment, then your doctor or dentist can give you a breakdown of all the expected costs, which you can send to the insurance company and they'll tell you what they're prepared to cover. This whole system, the insurance companies, the hospitals, the doctors, the nurses, the dentists, and so on, is not run by the government. This avoids the pitfall of, for example, the British National Health Service, which is a vast bureaucracy and swallows a massive 18% of the government's entire budget. Instead, it's delegated to various non-government associations and companies, but they are very carefully regulated by government. The German constitution puts the federal government in charge of the broad policies, but not the day-to-day running. This then avoids the pitfall of, for example, the American system, where health insurance can be very expensive and you suddenly discover that you're not covered for something very important and very expensive, and everything is run for profit. Health insurance in Germany is a statutory requirement, which does make it sound as if not getting health insurance will land you in jail, but that's not the case. What it means is that statutory health insurance companies must accept people who can't get private insurance. If you have no insurance, you're not breaking the law, but eventually you'll be asked to pay all the premiums that you should have paid but didn't. Unfortunately, I've never been seriously ill, which is a very weird sentence to be saying. Unfortunately, I've never been seriously ill, so I can't give you the benefit of any first-hand experience of German hospital care. But it does have a generally good reputation, and while it's not perfect, it does normally give you access to good quality health care. And whatever your income, you should be able to easily afford it. I think that counts as a success. Thanks for watching. If you'd like to send me a postcard, hit...
Alrighty, well, that's the end of our presentation. Thank you guys for watching this, and if you have any questions, please reach out.